Hello everyone, this is Dr. Uma. Today I'm going to discuss about fetal circulation and congenital heart disease. Both concepts are interrelated. Without understanding fetal circulation, you cannot understand congenital heart disease. So we'll move to the next slide. First, we'll see about introduction to congenital heart disease. In short, we can say CHD. It refers to structural or any functional abnormalities of the heart or great vessels that are present at birth. We can understand very clearly any structural or functional abnormalities of the heart. It is present at the time of birth. Okay. So to understand more about congenital heart disease, we need to understand some of the important concepts like critical period. So congenital heart disease develops between the third to eighth week of gestation. This is a period the heart and other chambers gets developed, and this is one of the most common congenital anomalies seen in newborns. It also affect multiple organ system, and it needs a specialized care. And third important concept is this, you know, this kind of congenital heart disease sometimes mild defects. It can leads to life threatening conditions also. So but it needs immediate intervention. This is about incidence of CHT. CHT occurs in approximately 8 to 10 per thousand live birth globally, making it significant public health concern in pediatric and obstetric care. This slide explains about causes and risk factors of CHT. The number one factor is genetic factor. So chromosomal abnormalities such as Down syndrome, like trisomy 21, are strongly associated with the CHT. Even positive family history of congenital heart disease also one of the important risk factor. Then maternal factors. Under the maternal conditions like diabetes mellitus, poor nutrition, advanced maternal age can contribute increased risk of cardiac malformation in the developing fetus. Exposure to rubella infections during the first trimester, even alcohol consumption, any drug abuse can cause CHD. Some of the teratogenic effects like exposure to radiation or unwanted medicines can cause fetal cardiac development problem. Despite of extensive research, many causes of CHD remain idiopathic. It means idiopathic means we don't know actually the real cause, otherwise risk factor of CHD. This is about overview of fetal circulation. Fetal circulation is a specialized circulatory system that exists within the developing fetus during pregnancy. Also, it is a unique system that ensures the developing baby receives adequate oxygen and nutrients. It differs from the adult circulation because it bypasses the lungs and liver through specific shunts. So, through the shunts, lungs and liver receive oxygen and other nutrients from the mother via placenta. So, we need to understand more about placental gas exchange. Here, fetus receive oxygenated blood from the placenta through the umbilical vein, as the lungs do not participate in gas exchange before birth. This is one of the anatomical structures allows blood to bypass the non-functioning lungs, directly oxygenated blood efficiently to the vital organs, especially the brain and heart. It also provide nutrition supply to the fetus. All oxygen and nutrients required for fetal growth and development are supplied through the placenta and umbilical cord, it establishing a maternal fetal circulation connection. This is about key structures in fetal circulation. So before going to talk about fetal circulation, we will understand about the umbilical cord. Umbilical cord is having two umbilical arteries and one umbilical vein. It is covered with water and jelly. Umbilical cord is the connection between the fetus and the placenta. Placenta is attached with the uterus. Okay, so now we'll talk about the six important structures involving in fetal circulation. The first one is the umbilical vein. Umbilical vein carries the oxygenated blood from the placenta to the fetus, delivering the nutrients and oxygen rich blood to support fetal growth. You can see in this picture that this is placenta. From the placenta, one umbilical vein which is started from the placenta, and it is entering into the fetus body through the umbilicus. It is directly going to the fetal heart. Before going to give the blood supply to the heart, some parts of the umbilical vein is getting connected with the liver, and it provide 100% oxygenated blood to the liver. Afterwards, you need to understand ductus venosus. Okay, so why we are telling this is ductus venosus? It's a vein to vein connection, umbilical vein and the inferior vena cava. Inferior vena cava receive the deoxygenated blood from the lower parts of the body, and it is transporting the deoxygenated blood to the heart, especially to the right side of the atrium. Okay, so here look at the picture. Ductus venosus, this part is known as the ductus venosus. It's a vein to vein connection where the umbilical vein is getting connected with the inferior vena cava. Okay, now this 100% oxygenated blood is changed into 80% because inferior vena cava receive the deoxygenated blood. Okay, so before the blood is reaching into the ductus venosus, then afterwards this 80% oxygenated blood is reaching to the right atrium. Okay, normally what it happens actually, once the blood is accumulated in the right atrium, it goes down, it means right ventricle. From the right ventricle, normally through the pulmonary artery, it is going to the lungs. From the lungs, the oxygenated blood is reaching through the pulmonary vein to the left side atrium, and it is going down, I mean left ventricle, then afterwards through the aorta. This is the normal circulation which happens in the adult. But I already said that lungs is not matured. Lungs itself need some of the blood, oxygenated blood, for its maturation, and lungs is not functioning. So so there is no need to send the blood to the lungs. And also already umbilical vein carries the oxygenated blood, 100% oxygenated blood, right? So after reaching the right atrium, it is directly bypass the pulmonary artery. It is not going to the right ventricle, it is moving to left atrium. Okay, so this connection is known as a foramen ovale. It means the opening between right and left atrium. Okay, this connection, so look at here, this is foramen ovale. So till now we have seen three. Number one, umbilical vein, it carries the oxygenated blood, and parts of this umbilical vein supply the some amount of blood to the liver. Then it is getting connected with the inferior vena cava, I mean IVC. It is called a ductus venosus. Once this blood is reaching to the right atrium, directly right atrium to left atrium, blood is bypassed. Okay, this connection is known as the foramen ovale. Then once it is gone, that oxygenated blood reaches to the right atrium to left atrium, then left atrium to left ventricle. From here aorta taking the blood all over the body. Okay, so this then this is after this happening. See here, look at here, some of the blood is reaching to the right ventricle also. Okay, so what's happening in this blood? This blood actually moving to the pulmonary artery, and of course some amount of blood is going for the lungs. That is not for the purification, that is for maturation. Okay, lungs maturation. So remaining amount of blood is again bypassed to the aorta directly. Okay, here look at here, this is called a ductus arteriosus. This means artery to artery connection. Here two arteries are getting connected, I mean pulmonary artery and aorta. Okay, so once the blood is reaching to the aorta, of course from the aorta the blood is passing through all over the body. Now look at here, this is the fifth important structure, that is hypogastric arteries. Okay, so these hypogastric arteries carries the deoxygenated blood, and it is passing the blood to the placenta up to umbilicus only. Okay, so inside the fetus body, we can say it's a hypogastric gastric artery. Once it is outside the fetus body, it is known as the umbilical arteries. Both structures are carrying the deoxygenated blood from the fetus body, and it is reaching to the placenta for the purification. Actually, placenta is the center where the oxygenated blood and deoxygenated blood is exchanged. I mean, deoxygenated blood is changed into oxygenated blood. Okay, this is about fetal circulation. This slide explains the transition from fetal to neonatal circulation. Actually, the transition from fetal to neonatal circulation is a critical physiological process that occurs within a minute to day after birth. The dramatic changes in triggered by the infant's first breath and involves the closure of the fetal shunts. So, in previous slide, we have seen so many, shunts are available for the fetal circulation, but it is not going to stay once the baby got birth. Okay, so what's happening, how it is getting closed? So first breathe. Okay, the first breathe expands the lungs. Once the lungs get expansion, dramatically it decreases the pulmonary vascular resistance. Once it happens, it increase the blood flow to the lungs for oxygenation. So after this thing, what's second one is the foramen ovale closure. Immediately increased left arterial pressure causes the foramen ovale to close functionally within hours. So once the baby birth got first breathe, within an hour, the foramen ovale, the connection between the right and left atrium got closed. Okay, so it will prevent the right to left shunting of the blood. So if suppose it is not closed, the foramen ovale is not closed within an hour, that disease is called ASD. Okay, so in following classes we'll see about that. Then third important changes happening, ductus arteriosus closure. Okay, how it is getting closed? The ductal artery begins to constrict within hours after the birth of the baby. What's happening? The ductus arteriosus start to constrict. Okay, then automatically it closes completely within 2 to 3 days due to increased oxygen levels and decreased prostaglandins. Okay, this is what ductus arteriosus is happening. If suppose this ductal arteriosus is not closed, this is also cause on a kind of disease that is called a PDA. Okay, patent ductus arteriosus. Then next, fourth one, ductus venosus closus. How it is happening? The ductus venosus closus as umbilical circulation ceases, completing the transition to normal neonatal circulatory pattern. Okay, so these important closure, I mean there are three types of closure available as we seen previously. Foramen ovale closes within hour. Okay, and ductus arteriosus close within 2 to 3 days, and also within some days ductus venosus also getting closed. Okay, if it is not closed, definitely it will cause some kind of congenital heart disease of the new. Now we'll talk about classification of congenital heart disease. Okay, basically congenital heart disease broadly classified into two category. One is the cyanosis and acyanosis. Okay, so what is acyanotic congenital heart disease? It is characterized by left to right shunt. It means always blood passes from left side to right side. Okay, so and there is no cyanosis present in the initially, and also normal oxygen saturation in early stages. May it progress these symptoms over a time. Increased pulmonary blood flow also will be present in this acyanotic congenital heart disease. And the cyanotic congenital heart disease, this is more dangerous from acyanotic because here there is a mixing of oxygenated blood and deoxygenated blood. Okay, but in acyanotic, what is happening? Blood is passing through the left to right shunt. It means generally we all know that right side contain deoxygenated blood, and right and the left side oxygenated blood is there. Okay, so if oxygenated blood is getting mixture with the right side, I mean deoxygenated blood is, it's not a major problem actually. But in cyanotic congenital heart disease, what's happening? The blood flows moves from right to left shunt. Okay, right side actually it is having what kind of blood? Right side, right side heart is having deoxygenated blood. Deoxygenated blood is moving to the left side, I mean oxygenated blood. So again the all over the body parts, what's happening? They are receiving deoxygenated blood. So that's why it is causing cyanosis of the baby. Okay, and basically bluish discoloration visible in the cyanotic congenital heart disease. It require urgent intervention. This is about subtypes of congenital heart disease. I already said that there are two types basically available, that is acyanotic and cyanotic. Okay, so acyanotic conditions are having again two types, that is left to right shunt and obstructive lesions. Under the left to right shunt, important conditions are available, like atrial septal defect, ventricular septal defect, pattern ductus arteriosus, atrioventricular septal defect. And under the obstructive lesions, pulmonary stenosis, aortic stenosis, coarctation of the aorta. These are the conditions available in acyanotic disease. And cyanotic congenital heart disease, two types are there: decreased pulmonary blood flow and increased pulmonary blood flow. Under the decreased pulmonary blood flow, tetralogy of Fallot is there, tricuspid atresia, pulmonary atresia, Epstein anomaly. And increased pulmonary blood flow, there are three conditions are available. One is the transposition of the great arteries, and truncus arteriosus, and hypoplastic left heart syndrome. So we need to study all of the congenital heart disease. In following videos, I will discuss about this. Thank you so much for listening me.